Welcome, ladies and gentlemen, to today's tutorial. And today we want to look at the knee joint. On the knee joint, in fact, three bones are actually coming together to form the joint. Superior, we are going to have the femur. Inferior, we are going to have the tibia, with the sesamoid bone also contributing to it. But remember that the fibula does not contribute to the formation of the hinge joint. Of this, knee joint, where is a hinge joint? Now remember, we say it's a hinge joint, but it's actually a modified hinge joint. Yes, because we all know that hinge joints generally are going to be uniaxial or monoaxial, permitting movement in one plane, usually flexion extension. But what happens is that this hinge joint is able to permit some limited rotation as regards medial rotation and lateral rotation. Yes, in fact, it is a synovial joint. If it's a synovial joint, then of course it's going to have a joint capsule, which lying within it will be the synovial membrane, going to secrete synovial fluid for lubrication at the joint. Yes, apart from this, lubrication provided, there are also some fluid-filled, sacs known as bursae, which we will look at pretty soon. Yes, for orientation, this is the femur, the proximal bone of the knee joint, and the femur is going to have these condyles, these femoral condyles. Okay, the medial and lateral femoral condyle, and then there's the medial epicondyle. Now on top of the medial epicondyle is this tubercle known as adductor tubercle. Adductor tubercle, actually for insertion by what you call adductor magnus muscle, which we will get to understand. There's the lateral epicondyle of the femur. Okay, lateral epicondyle of the femur, and then of course, if you come here, this is the tibia. The tibia, is going to have this tuberosity, which is, overshadowed by this ligament. And then, at the lateral aspect of the proximal aspect of the bone, tibia, we have this Geddes tubercle, actually for insertion by the iliotibial tract or iliotibial band. Well, this is the fibula. This is the head of the fibula. And we said the fibula does not really contribute to the formation of this, joint. But what happens is that helps in stabilizing it, by connecting, the head to the lateral, condyle of the tibia. We have the head, fibular head ligament of the head of the fibula. This is the anterior fibers, and then of course we have the posterior fibers as well. Yes, between these two bones, these are the leg bones. Therefore, we have this interosseous membrane connecting them. Now, if we said that we are also going to have these fluid-filled sacs known as bursae, going to help to reduce friction at some joints. Now we have several bursae, but notable ones will be the prepatellar bursa, which is actually subcutaneous, formed between the subcutaneous or the hypodermis of the skin and the patella. That's the prepatellar ligament, prepatellar bursa. Now at the superior level, we are going to have the suprapatellar bursa, which is formed, between the quadriceps femoris tendon, and the distal aspect of the femur. Yes, again, we are also going to have this ligament known as infrapatellar, below the patella, which are actually two. You have the superficial one and a deep one. The superficial one finding itself between the patellar ligament and the skin. It's also subcutaneous, and then the deep one finds itself between the patellar ligament and the tibia, anterior aspect of the tibia. Yes, there's also another one known as the semimembranous bursa, with the semimembranous bursa finding itself between the semimembranous muscle as well as the medial head of the gastrocnemius muscle, which we will look at in our later sections. So now, this joint actually bears weight. And it's the one which is formed between the condyles of the femur and the condyles of the tibia. Now, remember, you can see these articular cartilages of hyaline cartilage around the condyles of the femur, and then you also have that you find for the tibia. These are the articular, cartilages of hyaline cartilage. Now, in between these condyles, now we said that this joint is actually modified. In between the condyles of the femur and the tibia, then we're going to have a condylar joint, condylar joint. And then in between the condyles of the femur, and then, that we find articular surface of the patella, that is going to be a saddle joint. So it's indeed a modified hinge joint. Now, this joint, we've seen that it's going to bear some weight. Therefore, its stability is very important. Its stability is actually provided by, two groups of muscles. We have the intracapsular ligament, and we have the extracapsular ligament. Intracapsular ligaments are found in, the capsule, and extracapsular are found outside the capsule. Now, if you look at this one, you can see there are C-shaped, disc of fibrocartilage known as meniscus. Plural is menisci. So this one, because it's oriented laterally, this is the lateral meniscus. And then we have another one known as the medial meniscus. In fact, if you look at the posterior aspect too, you can see these menisci still there. Now, these menisci, what they do is that they absorb shock at this, tibiofemoral joint. What they also do is that they also deepen the articular surfaces. Now, connecting these two menisci is this, ligament. Is this ligament that you find here, and this ligament is the transverse ligament of the knee. But because it's between the medial and lateral menisci, then we are going to call it menisco-meniscal ligament. Menisco-meniscal ligament. We're going to connect these two ligaments. This menisco-meniscal ligament is actually one of the intracapsular ligaments of the knee joint. Now, the main two intracapsular ligaments which we look at, are the anterior and posterior cruciate ligament, because they form an X-shaped, structure. So they cross each other, and therefore we call it anterior and posterior cruciate ligament. Now, this is the posterior cruciate ligament, which actually originates from the medial condyle of the femur, and then inserts at the posterior intercondylar area. This ligament is known as the posterior cruciate ligament. Now, the anterior cruciate ligament, which originates from the lateral condyle of the femur, and then inserts in the anterior aspect of the intercondylar area, is the anterior cruciate ligament. Now, what the anterior cruciate ligament does is that it prevents the tibia from slipping anteriorly on the femur, or the femur slipping posteriorly on the tibia. The posterior cruciate ligament, on the other hand, prevents the tibia from slipping posteriorly on the femur, or the femur slipping anteriorly on the tibia. So that is the cruciate ligament, very important in stabilizing this joint. Now, we also find that there will be extracapsular ligament, and notably we have this ligament over here, which is known as the lateral collateral ligament, spanning all the way from the lateral epicondyle of the femur to the lateral aspect of the head of the fibula. This is the lateral collateral ligament, but because it's related to the fibula, then we also call it fibular collateral ligament. Now, on the other hand, we also have this ligament spanning from the medial epicondyle of the femur to the medial condyle of the tibia, even going to the proximal aspects medially of the shaft of the tibia. This ligament is known as the medial collateral ligament. This medial collateral ligament, because of its relation with the tibia, can also be called tibial collateral ligament. And what they do is that these collateral ligaments prevent excessive slipping of these bones laterally or medially. So this one, medial, will prevent excessive slipping laterally, and then the lateral one will prevent excessive slipping at those joints laterally, so that you keep the articular bones in place. Now, generally, these ligaments, what they are going to do is to prevent hyperextension, but individually they may have a particular role to play. Now, connecting. Now, we have these ligaments, which we've seen the cruciate ligament, we've seen the transverse ligament of the knee. We have seen, the collateral ligament, but there is this ligament too, which spans all the way from, the lateral meniscus of the knee to the medial condyle of the femur, and this ligament is known as meniscus femoral ligament. Meniscus femoral ligament. This ligament is very important because what happens is that the medial meniscus that we saw, actually, apart from finding attachment, in the intercondylar area, we also, have attachment with the joint capsule as well as fixed to the medial collateral ligament. It's fixed to the medial collateral ligament. So, but the lateral meniscus is not fixed to the lateral collateral ligament. Therefore, its stability is very important. It's quite mobile, and therefore its fixation will have to be provided by this meniscus femoral ligament, so that it will keep the articular surfaces in place, so that there's no slipping away. So it's very important, this ligament, meniscus femoral ligament. Now, so we've seen that yes, although this fibula is not going to do it, but we have some ligament over here around the head of the fibula. So, ladies and gentlemen, this is a quick tutorial as regards the knee joint. Now, the knee joint is actually supplied by the genicular artery, forming a great anastomosis, which we'll see later, and therefore it's as far as avascular necrosis is happening, it's very rare. It has a rich blood supply. Now, in terms of innervation, it's actually coming from the femoral nerve, as well as coming from the common peroneal and the tibial nerves of the sciatic nerve, which we'll look at later. But of course, because of its nerve supply, and we know that the hip, at the hip joint, what happens is that in addition to the rotator nerve, these nerves also supply the hip joint. Therefore, there could be referred pain. So pain at the knee could be referred to the hip, and vice versa. So therefore, when it comes to the clinical aspect, investigating pain, these two things need to be taken into consideration. Thank you very much for your audience.